Assalamu alaikum. Today's topic is pneumothorax. Presence of air in pleural space making it an air containing cavity is called pneumothorax. Etiological classification can be divided into spontaneous and traumatic. First of all, spontaneous. Primary, no underlying disease, 20 to 40 years old, tall male smokers. Secondary, number 1 COPD, emphysema. Number 2 ILD, interstitial lung disease. Number 3 bronchiectasis. Number 4 lung abscess. बात करें ट्रामेटिक की, नंबर 1 penetrating chest injuries, number 2 pleural tap, number 3 pleural biopsy, number 4 bronchoscopy, number 5 mechanical ventilation, number 6 CVP line. Pathological classification includes 3 types of pneumothorax. First of all, closed pneumothorax. Opening will be small, heals rapidly, air reabsorb. Open type, opening will be small, remains patent, acts two-way valve. Tension pneumothorax, opening is small or large, remains patent, acts only one-way valve with each inspiration. Pleura balloons up, lungs collapse and mediastinal shift. बात करें क्लिनिकल फीचर्स ऑफ pneumothorax की, तो फर्स्ट ऑफ ऑल रिस्क फैक्टर्स होंगे, प्लस सडन ऑनसेट डिस्पनिया, ड्राई कफ, प्लूराइटिक chest pain. On examination, tachypnea, tachycardia and cyanosis. Chest examination पे, inspection पे, bulge, decrease chest movements on affected site. Palpation, trachea pushed, decrease chest movements on affected side, vocal fremitus decrease. Percussion, which is hallmark for pneumothorax, hyper resonant percussion. Auscultation, decrease air entry, vocal resonance decrease. Progression of dyspnea. Dyspnea starting improving. The type of pneumothorax will be closed. Dyspnea neither improves nor worsen. It will be open pneumothorax. Dyspnea keeps on worsening with each inspiration is pneumothorax, which is tension pneumothorax. बात करें इन्वेस्टिगेशन की, तो इन्वेस्टिगेशन ऑफ चॉइस CXR, चेस्ट एक्सरे, जेट ब्लैक लंग्स होंगे, लॉस ऑफ पल्मोनरी वास्कुलेचर मार्किंग्स की वजह से, लॉस ऑफ पल्मोनरी वास्कुलर मार्किंग्स, इंक्रीज ट्रांसलूसेंसी, इंक्रीज ब्लैकनेस ऑन अफेक्टेड साइट. रेडियोलॉजिकल क्लासिफिकेशन की बात करें तो स्मॉल pneumothorax लेस देन 15% वॉल्यूम, मॉडरेट 15 to 50% and massive more than 50% will be tension pneumothorax. That's it about pneumothorax.